Last time we chatted with the robot doc, we learned all about his roots, being a local boy from Keau on the Hawaii island, and then now he's an orthopedic surgeon specializing in hips and knees. And today we're going to discuss robotic total hip replacements, which sounds pretty interesting. Dr. Paul Morton joining us now. Thank you so much for being with us. Appreciate it.
Hi, good morning, John. Thanks for having me on the show.
I understand that you were the very first surgeon in Hawaii to perform a robotic hip replacement. It sounds really, really cool. Can you tell me about robotic hip replacement?
Absolutely. So first off, I think the important thing to know about hip replacements is that hip replacements are a great surgery that help people return to their normal life, you know, especially after dealing with extreme pain that can be pretty debilitating. Robotic hip replacements gives us the ability to get people up and moving a lot faster than I mean, it helps us to restore the anatomy from where they were before.
Okay.
And lets us give minimally invasive incisions that are smaller than what we would have done normally, and helps us to make sure that we're restoring the leg lengths that we want to restore, and make sure that we're putting our implants in more accurately.
Okay, now I'm sure that's probably the difference. What you just rattled off was the differences between a normal surgery and the robotic surgery, yes?
Correct.
Why would somebody even need hip replacement?
So hip replacement is pretty common. People typically need hip replacement for either congenital things like hip dysplasia, or something that occurs when the blood supply is not supplying very much blood to the femoral head, and you can get a dead bone. So that's called avascular necrosis, or most commonly osteoarthritis. As we get older, our bones just our cartilage starts to wear out, and that's when we start talking about, you know, needing to intervene at some point.
Okay, so the difference between robotic hip surgery, regular hip surgery. I want to know, does everybody who needs hip replacement, can they benefit from robotic hip surgery? Can everybody who needs a hip go through robotic hip surgery?
So I would say that the vast majority of patients who need a hip replacement, especially if it's, you know, routine hip arthritis, a robotic hip replacement would give them the ability to get a more accurate component positioning than they would with traditional methods.
The last time you were here, we talked about knees, but there are new implants now. Tell me about that.
So I kind of wanted to talk a little bit about ACL repair. So. Okay. Traditionally, when we did ACL, an athlete gets an ACL tear when they, you know, they get hit in the football field when they're wrestling, you know, you tear your ACL, and we typically take a graft from somewhere else in the joint. I mean, in the knee. Okay. And we try to reconstruct the knee, and we do pretty well with those. The issue with those is that sometimes we don't restore the anatomy like we normally do. There's a new implant that's out there that allows us to actually repair the ACL, provide the blood supply, and actually get patients to get back out to playing sports without having a reconstruction.
That's exciting.
Yeah.
Yeah, that's really, really exciting. Okay, so that begs the question then, how can somebody find out more information about what you guys do as the robot doc, and how can they get in touch with you for a consultation?
So I have a website. My website is www.drmorton.com, and you can also reach me at 808-439-6201. That's my office number.
And you're on this island and on Hawaii Island, yes?
I'm on both in Honolulu. We also have an office out in Kunia, as well as in Kona on the Big Island.
Awesome stuff. Thank you so much for being here. We really appreciate it. Of course, we'll have all of that information on our website shortly after the show.